Hey guys, once again welcome to the Physio Tribe. I'm Samantha David and I'd like to thank you all once again for watching this video. Now this is the fourth part of the four-part series on clinical reasoning. And just a quick refresher, so far we spoke about the thinking processes involved in reasoning and two of the three principles, which were hypothesis, strategies, and then categories. So today we're going to talk about the last one, which is knowledge. So this has to do a lot with the clinician's knowledge. It further has three bits to it, which is critical thinking, metacognition, and knowledge organization. So what is critical thinking? Critical thinking is nothing but critiquing, analyzing all the information that we get through our assessment and our management. It's about not assuming things and thereby reaching a stage where we can make unbiased decisions and be effective practitioners. Again, how do we do this? By testing a hypothesis that we spoke about in the previous video, and by screening questions, and by understanding the patient's story or the patient's side of things. So that is critical thinking. The next is metacognition. It is nothing but self-awareness. So sometimes as clinicians, it is important for us to get out of our mind or just get out of the clinical scenario and look at our practice as a third person. As much as it's important to understand the different reasoning processes, it's also to critique our performance. So what I mean by that is it's about understanding our limitations, about understanding how much we don't know, the gaps in knowledge. So we know that experts are really good at knowing what they know, but they're also really good at knowing what they don't know. So what it means for us is to understand when a particular treatment is not working, when a particular treatment needs to be abandoned, when we need to refer a client on for further investigations or to another healthcare professional. So that's metacognition. The next is knowledge organization. Now that has two main aspects to it. One is knowing, which is basically something that we get through, academic journey, through research, okay? The basic foundation of physio. And the next aspect to it is knowing how to. Now this only comes through practice and experience, but also understanding our knowledge, understanding our personal experience, and also a lot to do with, the diverse population, the culture that we come in contact with. Why is this important? Because all in all, both of these, when integrated, helps us then deliver a tailored program for our client. So yeah, this bit is a little heavy, but that's clinical reasoning principles for you. Now, this next case study that I'm going to talk about is important because it always brings to my mind this particular quote by a very famous physician, Dr. Osler. And it says that, listen to your patient. He's telling you the diagnosis. So, this client, I treated her a year and a half ago. 60-year-old female that I seen for a mid-back issue that she had for a good 4 to 6 weeks prior to seeing me. So she had a family business and worked in the finance department, or rather looked after the finance and the accounting aspect of things. And because of the family business, there were no, timelines. And more importantly, she always had to travel in the outskirts on the weekends. So she came to see me for constant, persistent thoracic pain and not seeing a physio or any healthcare professional prior to that. Her main complaint was, or just talking about the behavior of symptoms now, the area of pain was more on the right side, but also a bit central in the mid-thoracic area between T4 and T8. And besides pain, her other complaint was stiffness. So initially, complaints were intermittent pain, pain score of 6 on 10 at its worst. And she said that the few things that aggravated her pain included, sitting at the desk for too long after a very heavy, week. And things that made it better was a hot shower or a massage. Didn't complain of any night pain. Complained a bit of stiffness in the morning, but something that was her normal. Screened her for red flags. I didn't seem that she had any at that point in time. In terms of psychosocial status, very stressed. She mentioned she was very stressed, very overworked, and almost reached her burnout stage, was at that stage. She didn't know what was happening, but just wanted some help and wanted to know what exactly was going on with her. So at this point in time, after it's subjective, although what I gave you is a gist, but the few things that were running around my mind was probably a mechanical picture. Could be anything ranging right from, the discs, the ligaments, or your facet joints, your cost transverse joints, or it could be muscular. So I didn't know that, so I had to test all of those. So physical examination, so an observation, I had a classic kyphotic posture. In terms of range of movement, it was restricted quite a bit in, thoracic extension, and more so a right side rotation, lateral flexion. On palpation was quite hypertonic around, her thoracic extensors, and was had a painful experience most on the right side on palpation. In terms of a passive accessory joint assessment, was quite stiff all through the thoracic spine, mid-back, right from T4 to T10, and the right side was particularly more painful for her. So all in all, at the end of it, seemed like she had this insidious onset, so there was no history of injury, probably because of a couple of factors: lack of physical activities, like she mentioned, because she's really busy, didn't have time for any exercises, nothing. And some contributing factors in terms of stress and, being overworked and things like that. So we started a treatment with a bit of mobilization, a bit of exercises, range of movement in the beginning. And because she responded well, so had a bit of relief for the first 3 days, and then by the end of the week again, was almost close to where she started. I saw her over a period of 6 weeks, and unfortunately at that time, she couldn't see me quite often, considering the fact that she had to keep traveling. But remember, I think it was around the 4th visit wherein she came in complaining of a lot of pain, and her presentation seemed a little different. Her pain was more widespread, and she also complained a lot of fatigue that did not get better with rest or remained even after a good night's rest. The other thing she complained of was swelling in her feet, and she said something, she felt bloaty. On assessment, very, very, very similar to what it was, but on palpation, she's very, 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 very sensitive to touch, to pressure. So at the end of that assessment, we both had sat down and had a chat, and probably were considering what this could be because it was so different. And I remember this thing that she told me was, Samantha, this is not normal for me. I know what it means to be exhausted. I know what it means to be, burnt out. This is something different. And I was like, okay, then let's just get this investigated. Let's get a whole blood profile done, blood test profile done. Let's get some inflammatory markers checked and see what is happening here. So I think after 2 weeks, I did a phone call assessment, and from what I know, I think she had most of her inflammatory markers were over the roof, and at that point in time she was really busy, couldn't come in to see me. But after a month, made another call to check on her, and she mentioned that after she got the blood test done, she went on to see her rheumatologist, and was cleared off from any inflammatory arthritis kind of an issue. However, further investigation resulted in knowing that she had multiple myeloma, and although she was upset, at the back of her mind, she was also a bit at peace because she knew what was going wrong rather than being in that darkness of not knowing. So I recently had a chat with her because she came in with her daughter for something else, and she seems fine, is well, is alive, which is important after having that diagnosed. But I think all of this helped me understand that we really need to listen to our patient, and more importantly, it is them that lives with the condition. And although we, being professionals, are trained to assess it, but there's a whole lot of things that we can miss if we don't listen. I hope that was helpful. Thanks once again for watching all of these videos. And before I end this, I'd like to present to you our next speaker, who is Alicia Fernandez, and she'll be talking a little bit about how one transfers the knowledge that we get in a university through clinical practice, so physio knowledge to clinical practice. Hope this has been helpful. Take care.